Thank you, Steve. That was terrific. And Steve set up this next session. We had the box that led from the figure that had one arrow that went from education to health, and then he also showed another arrow that went from health back to education. And that's the focus of our discussion for the next few minutes. I'm Bob Kaplan. I'm a member of the Roundtable and also a professor at Stanford University. And it's my pleasure to introduce Charles, or Chuck, as he prefers, Basch, who is the Richard March Ho Professor of Health and Education at Teachers College at Columbia. And Chuck, it's a pleasure to have you here. Thanks. Oh, of course.
Morning. Thank you, Bob. Thank you for the Roundtable for inviting me, and more importantly, thanks for addressing this topic, because while there's many influences on children's health, I think schools are one of the key social institutions that shape their lives. Dr. Wolf just explained how education affects health, longevity, and income, employment, and for many people, I suspect the reverse connection between health and education seems pretty obvious, but it's really only the last 2 decades or so that research has uncovered the reasons why that's the case. I want to start out by talking about just a little context for education. And the idea here is that no matter what standards are put in place, no matter how schools are financed, no matter how effectively teachers can teach, how rigorous curriculum may be, how we organize schools, the benefits of all these efforts are going to be limited if students are not motivated and ready to learn. And the idea is that there's certain health problems that have profound and often overlooked effects on students' motivation and ability to learn. So, as you can see, these factors of health and education are related in reciprocal ways, and as Steve mentioned, there's often this underlying social and economic factors. And I'll focus on the ways that health affects education, and in doing this, it's important to recognize the broader context for this, which is that there's many factors that affect both health, education, and poverty: racism and discrimination, parenting, community, economic conditions, government policies, housing and segregation, media, family support. I'm going to focus specifically on research that's delimited in scope to urban and minority youth, to school-age youth, and to health problems that can be addressed through schools, which is not to undermine youth from rural areas or the importance of focusing on the preschool population, but that was how I concentrated. So one of the things that's challenging is that schools can't do everything. There's a need for them to prioritize. So how do they select strategic priorities? Well, in my talk, I tried to focus in on selecting those priorities based on the prevalence of health problems, the evidence that certain health problems have causal effects on educational outcomes, and that there are proving or promising programs that already exist to do something about those problems. And based on those criteria, I have a list of 8 health barriers to learning that I'm going to use as illustration for the talk today, and those are poor vision, poorly controlled asthma, teen pregnancy, aggression and violence, physical inactivity, skipping breakfast and hunger, ADHD, and oral health problems. So all of these problems are highly prevalent. Vision affects an estimated 1 in 5 low-income youth. This is actually not great data available for this particular problem, so that's an estimate. Based on the work I've done with the Children's Health Fund in New York City, the rates we've seen were actually a little higher than this. Asthma affects 8.3% of youth under 18. That's over 6 million individuals that have current asthma. The real issue is poorly controlled asthma, as indicated by overuse of emergency rooms and underuse of efficacious medications. Current rates of teen births are about 20 per 1,000. That's for 15 to 19-year-olds, which is at the lowest level it's been in quite a while. Nevertheless, compared with white teens, the rates for African American and Hispanic teens are about twice as high. Notwithstanding Steven Pinker's fabulous book, the aggression and violence remains pervasive in our society. In the past year, 20% of high school students report being bullied at school, over 20% being in at least one physical fight in the last year. That's the rates almost 30% for males versus about half that for females. And these data I'm presenting here, a lot of them are based on the 2015 Youth Risk Behavior Survey. I wanted to update it for 2017. The results actually are supposed to come out this afternoon, but I suspect they won't be too much different. In the past month, 5.6% of all high school students had missed one or more days of school in the last month because they were afraid to be at school or travel to or from school. Compared with white students, that rate was about more than 20% greater for African American students and more than 36% greater for Hispanic students. With respect to physical activity, about 50 to 75% don't get enough. Approximately 14% of high school students skip breakfast. Breakfast is not only important because it provides nourishment after a long period of sleep, but because 1 in 6 children in America live in households with food insecurity. That's over 13 million. The numbers are far greater in the poorest populations, and that's according to the American Academy of Pediatrics and the Food Research and Action Council. And 11% of 4 to 17-year-olds have ever been diagnosed with ADHD, and 8.8 have a current diagnosis. There's been controversy about overdiagnosis and underdiagnosis and overtreatment and undertreatment, but I think there's no argument that ADHD remains a pervasive and important problem. And 23, almost 1 in 4 2 to 11-year-olds have untreated caries. Another topic I just want to touch on is mental health, because I don't have a separate category for it, but mental and emotional health includes a wide range of health problems and is a cause or consequence of every one of these other behaviors. In the past year, almost 30% of high school students say they've been feeling so sad or hopeless almost every day for 2 weeks or more in a row that they had to stop doing some usual activities, and that rate was almost twice as high for females as it was for males. And Dr. Wolf mentioned the adverse child experience studies showed how what Jack Shonkoff's called toxic stress has long-term consequences for health, longevity, and overall quality of life. So these data, they're not new, but in the next topic I'm going to talk about, which is how and why do these problems affect educational outcomes, is largely based on research conducted in the last 2 decades or so. And I want to talk about these 5 different causal pathways that affect educational outcomes: sensory perceptions, cognition, school connectedness, attendance, and dropout. So we talk about causation. Us as academics are very concerned about causation. But think about good vision is really a key to learning how to read, to write, to learn foundational literacy and numeracy skills. For example, if you were trying to decode words and you're looking at letters like P and D and Q, you know, those are hard enough to really distinguish when you can see them clearly. But when you have problems with visual acuity, becomes much more challenging. Cognition is really about thinking skills, such as working memory, focusing attention, completing tasks, listening and integrating information, organizing and planning, regulating emotions. School connectedness is about relationships with peers and school staff. To what extent do students feel that the peers and the adults in the school care about them as people, as well as learners? Is school a place where they feel like they belong? Is it a place they want to be? To the extent that they have that sense of connectedness, they're more likely to attend school and more likely to succeed in school. Absenteeism is a major factor affecting school achievement. Chronic absenteeism, which means missing 10% or more days a year, has attracted attention in recent years. Chronic absenteeism in the earliest grades leads to lower levels of reading on grade level, which in turn leads to higher levels of dropout. Chronic absenteeism in middle and high school is a strong predictor of high school graduation. And of course, temporarily or permanently dropping out of school has short and long-term consequences. So I want to make two important points before I go into a little bit more detail on these causal mechanisms. But first, there are reciprocal causal relationships between these pathways. So for example, I guess I can't go backwards. The student who's struggling to succeed in school is going to feel less connected, less likely to attend. The student, chronic absenteeism leads to greater risk of dropping out. So are these reciprocal connections between these pathways? So first, sensory perceptions. Visual acuity at near distance hyperopia is inversely associated with acquiring literacy skills. Inability to see at far distance will affect students' ability to read material on the board. Focusing is also important. The ability to quickly look up and down, shift your eyes from a far distance to a near distance. Tracking skills are essential in learning how to read and track words across a line and going to the next line. Youth with ADHD not only appear to have more ophthalmic problems, but sensory impairments related to the perception of time and timing mechanisms, which is essential in completing, say, a sequence of math steps and solving a problem. One of the things I'd like you to notice is that the next three sets of pathways, cognition, connectedness, and attendance, 6 of the 8 factors are related to this. And this is a really important point, because it has to do with the multifactorial etiology of influencing these pathways. So how do vision affect cognition? Well, here we're talking about visual motor integration, not visual acuity, but the connections between one's eyes and their brain is associated with reading, math, spelling, as well as standardized test scores. Aggression and violence is associated with intrusive thoughts, like we know, for example, through research on Claude Steele's work on stereotype threat, or John Barg's work on priming, or Daniel Kahneman's work, and that our subconscious mind plays an important role in our learning, in our behavior, in our performance. Well, imagine if you're worrying about being harassed, you're worrying about being beat up or bullied in some way. That's going to get in your way of really learning, not only while you're at school, but when you're at home. Disruptive behavior in the classroom not only influences teaching, it not only influences the learner, it influences the disruption of the classes for all the learners in the classroom. Recent advances in molecular biology and neurosciences has shown the causal mechanisms through which physical activity influence brain chemistry and cognitive function, which the Greeks knew about intuitively over 2,000 years ago, that a strong mind and a strong body were intimately related. Despite the evidence, physical education programs are being cut throughout America to try to improve standardized test scores. Skipping breakfast and hunger can affect alertness, focusing attention, memory, problem solving. According to the American Academy of Pediatrics, longitudinal studies have shown that food insecurity in kindergarten students predicts reduced academic achievement in math and reading over a 4-year period. It's not surprising that on the day before the standardized test, principals send a note home to parents recommending that the students get a good night's sleep and eat a good breakfast. I didn't mention asthma, but poorly controlled asthma affects sleep. And sleep is quite mysterious, but one thing that we do know about sleep is very important for our brain health, and it's a time at which we consolidate our memories, which is obviously very important for learning in school. And by definition, ADHD affects cognitive processing, memory, visual attention, recall of factual information, and comprehension. So school connectedness, too, is affected by 6 of the 8 factors. Uncorrected vision problems can't be overcome by trying harder. So imagine now you're 6 years old, you're in 1st grade, you're trying to learn how to read, but no matter how hard you try, you're not succeeding. what's the effect of that going to be? You're going to become demoralized. You're going to be more likely to get disengaged. You're going to feel like this is really frustrating. Children with poorly controlled asthma struggle in school. They tend to have more anxiety. They have more comorbidities. They have a harder time. They have disrupted sleep, and there too, they're having a hard time succeeding in school. If you attend a school where there's bullying, if you attend a school where there's nasty things said and written on the walls, it's not going to be a place where you want to be. It's going to be a place where you want to get away from. Physical activity has phenomenal potential to foster school connectedness by helping students learn about teamwork, to cultivate relationships, to support one another, persevere, and learn what James Heckman called soft skills or non-cognitive skills. Or, to me, they're very cognitive, highly cognitive. And then eating together is another way you can help youth culture cohere. Providing food for students at school is a way to express caring and cultivate community. One of the most tragic things you can learn about this research on ADHD is the students with ADHD don't have any friends. They have a real hard time having good relationships with the other students. Here too, I'm kind of running out of time, so I'm going to go a little quickly, but you see that 6 of these 8 factors also have an effect on absenteeism. Not controversial. Asthma causes poorly controlled asthma causes absenteeism. I showed you the slides showing more than 1 in 20 students miss school because of afraid to be at school. And I'm going to skip over some of the other points, but the research is there to back them up. So I did want to just mention, go back one, to talk about teen pregnancies, strongly associated with school dropout, even after adjusting for other known covariates. Teen mothers are 10 to 12% less likely to complete high school and have a 14 to 29% lower odds of attending college. And youth with ADHD is more than twice as likely to drop out from school. So I think, if children can't see well, if their eyes don't integrate with their brain, then, they're going to have difficulty acquiring basic literacy skills, basic numeracy skills. If their ability to concentrate and use memory and make decisions is impeded by ill nourishment, sedentary lifestyle, if they're distracted, it'll be more difficult for them to learn in school. If their relationships with peers are negative, they'll be less likely to feel connected and want to attend. If they're not in school because of uncontrolled asthma, oral health problems, ADHD, or because they're afraid to travel to school, they'll miss important opportunities. If they drop out, perhaps because they're failing or because they're socialized to believe that even if they complete school, there'll be no better opportunities, or because they became pregnant and no resources were in place to help them complete school, it's not likely they can succeed. And if they can't focus, they can't succeed. So what can schools do? Well, I know I just have a couple minutes here to talk about this, but there are synergistic effects. Many youth are affected by multiple problems simultaneously. Therefore, the most effective programs are going to focus on multiple health problems, multiple health barriers to learning. Not every school is different. There's a need for focus on strategic priorities, evidence-based approaches, and effective coordination. So strategic priorities have to do with focusing on, well, what's most important? So what's the magnitude and severity of the different problems in a particular locality? But they're also related to feasibility. What resources are available? Do we have somebody who wants to work on a particular problem? Is there political support for a particular problem? As well as acceptability, what do the parents, the school board members, and others in the community really want to focus on? It's really a local kind of issue. There's also a need to focus on evidence-based programs. These different problems are much harder to address than it may seem at first. Like, why can't we just get eyeglasses to the kids who need them? It's doable, but it involves many different steps and lots of coordination. But there are evidence-based programs that exist to deal with those. And effective coordination is an important element of this. There's been an effort by the Centers for Disease Control, as Dr. Wolf mentioned, along with the ASCD, to have this coordinated approach. And this shows, an attempt to break down the silos that have traditionally existed. And that's really what we're here talking about today. That's what it's all about, because The problems that we're focusing on have these reciprocal causal determinants, so focusing on these siloed solutions that we tend to have in research, policy, funding streams, professional preparation is going to really have limited benefits. And I'm excited about the afternoon session because these data dashboards that we'll be talking about are really going to be useful to figure out which children need which services at which point in time. And the last point I want to make is just schools can't do this alone. There's no way possible schools can do this alone. They need help from families, from health services providers, from community organizations, philanthropies, government agencies, institutions of higher education. So I think that's what we're here to talk about, and I appreciate the opportunity. Thank you.
Thank you, Chuck. That was terrific. So we're open for questions. I'll tell you, it's maybe the chair's prerogative. You know, I was thinking about when you were talking about the influence on these variables on health outcome. What really struck me was the aggression and violence, and that I was thinking about, far too many kids are getting injured by being beat up at school, but also with gun injuries and so forth. But I wonder have you ever thought about, if you look at something like a quality adjusted life here, so how much quality of life and function is lost just because kids are afraid to go out and function?
Mm-hmm. Yeah. Well, in the healthcare sector, normally don't think about this, but to me, really, this is the essence of the issue. It's about creating a school culture where the students feel like people care about them, where people are kind and nice to one another, where they're not afraid to take chances and fail at things and know that they won't be made fun of or stigmatized for being different, for who they are. So I think, as I said, while throughout human history we may be at a point where we're at a place where violence overall has declined, and that's a wonderful thing, but it's really uneven. And when we look at, it's worth reiterating the point that when we look at these disparities that we're talking about with respect to any of these health issues, as well as the education issues, as well as the economic issues, and Dr. Wolf mentioned it, it's the same population of young people. And really what this is about is the inequities and inequities in access to education opportunity that we're talking about here today. So I think the aggression and violence is a critical issue as it relates to school culture. Thank you. Yes?
Great. Thank you so much. Philip Alberti from the AAMC, roundtable member. I'm going to put on an old hat of mine when I worked for the New York City Department of Health and Mental Hygiene for about 8 years. Spent like 5 years working on teen pregnancy prevention in the South Bronx. Mm-hmm. And so your presentation of data, much appreciated, really important. And this is, I guess, a pitch to us to think about the cross-sector nature of these issues and the importance of community engagement in addressing them. So when we looked at the data for health and education outcomes of moms who are pregnant and not pregnant nationally, all of those disparities ring true. When you compare a 15-year-old South Bronx teen who gets pregnant to a 15-year-old South Bronx teen who does not get pregnant, no disparities, because the issues are in the South Bronx and with kind of the social services, the community level factors, the reciprocal nature of all the things that you talked about. So I think how we measure the inequities, what the comparator group is, it feeds into how we approach communities with the data, how we think about local policy, understanding that maybe federal policy is not the target right now. So I think just making sure that we all understand that the community level factors are so important and it is so tied together that we assume disparities exist when perhaps the important comparison, there are no disparities because of that kind of interrelated nature.
Yeah, so a couple of points on that. First, I do agree with you about the importance of focusing on the local and state issues. The United States is fairly unique in the world with respect to our education system, other than maybe Canada, in that most other places have a much more centralized control of their education system, where we have a much more decentralized education system, as well as all the funding, primarily comes from the state and local level, which actually is one of the reasons we're maintaining the status quo, and hopefully over time can be changed. And then on the other point about the underlying social and economic issue, I don't think there's any question about that. But at the same time, I don't think that should detract from efforts to try to prevent unintended, teen marital, non-marital births. So absolutely true. And just since you bring up the South Bronx and New York City, I'll take the opportunity to talk about one of the only evidence-based teen pregnancy prevention programs known in this country is one developed by my good friend Michael Carrera, who through the Children's Aid Society, and he started out focusing on sex ed and family life education and quickly found that wasn't going to work. And what it was going to take to prevent non-marital teen births was cultivating aspirations in young women by helping them succeed in school and providing academic tutoring and helping them get a job and develop financial literacy and having opportunities, creative arts and expression and lifetime sports. And really putting into practice this rhetoric about the whole child education. So, yes.
Hi, Denise Chrysler from the Network for Public Health Law and the University of Michigan School of Public Health. I'm putting on an old hat too, which was when I spent 6 years as a member of an urban school board, Board of Education. I didn't run for re-election because I was so discouraged. I was discouraged because I felt like our urban school district was had the responsibility for all urban problems, all of society's problems. Our resources were cut. At the same time, everything depended on those test scores. So forget art, forget, physical activity. If we didn't see that direct connection, and you've talked about how important that is, what kind of messages or how can people somehow advocate for what you said? Schools can't do it alone. There's a context to all of this. It's not just about test scores and what schools do.
Yeah, thank you very much for your question, because I think it's so important, and I think it's a lot of what this meeting's about, which is why I was so enthusiastic to participate, is there's a need for greater engagement of the other social institutions within our society if we're going to be able to make progress in tackling these problems. And these are problems that have existed for literally hundreds of years. So it's going to take time to make progress, but schools are not even, the magnitude of the problems in the schools that we're talking about are so great, and the teachers and the staff within the schools are so overwhelmed that it's not even remotely possible that without additional investment of mental health professionals, of school health coordinators, of linkages from community organizations to provide health services, from supports to provide, one of the things I'm disappointed about is how little institutions of higher education, and in particular colleges of education, have been involved in really working directly with their schools to address these health barriers to learning. So that's really, I think, what we're trying to do here today is foster that kind of greater involvement and break down the silos between the different sectors.
Hi, Dr. Basch, thank you for your talk today. Joaquin Tamayo, formerly of the U.S. Department of Education and a former New York City high school principal. The question I have is, I wonder how you think about the cultural and ideological context in which our education and our health systems operate in this country, on top of the decentralization. And right now we're in June, so we're in graduation season all across the country. And so we're doing lots of celebrating of our valedictorians. I recently received an invitation to a gala for kids who beat the odds, right? And so there's this really pervasive and very strong, very American sense of individualism. Pull yourself up by your bootstraps, no excuses, So how do we square this notion of really thinking about configuring our systems differently when the messages that we're sending to our kids and to our educators is that, despite the odds, despite what may get in the way of your ability to learn or to succeed in this country, at the end of the day, that's on you. That's not on other people. That's what my grandparents told me. It's what my parents told me. It's not on the systems that are supposed to be designed to support you. So, like, how do we square this, and how do we help people understand that, well, we don't have to let go of this notion of agency and efficacy of one's own abilities and drive, but that there's a responsibility on the part of society to balance that out with effective supports and not to continually undermine it with this idea that, if the outcomes aren't great for you, well, at the end of the day, that's your problem.
Yeah, well, I think in many ways your question really gets at the heart of the issue here. Because what this is really about is it's about political will to do something about this. And what it's really about for me is equal access to education opportunity. And if you can't see well, if you can't sleep at night, if you're afraid to go to school, if you're hungry, how do you have equal access to that education opportunity? So your question really gets at the character of our nation. And what we can do is we can show what's possible in local communities, in states. And there's actually really tremendous amount of exciting work going on all over this country in communities that are showing what can be different and how things can be better. So I think that's how it happens. And I think it also happens through leadership. Through leadership by elected officials saying, we're going to invest in this. We're going to take a stand on this. I think it happens through leadership in college presidents, in heads of philanthropies, in different business and industry organizations, in healthcare, health insurance companies. Say, we're going to invest in this. We're going to take a stand on this. This is really important to us. I think that's how it will happen.
Hi, my name is Mary Jane Puffer with the LA Trust for Children's Health, and I'm really happy to be here in this space. Our work is really focused on that in LA Unified School District. And so you talked about standards and taking a stand. And we have wellness centers that are built specifically, they're school-based health centers, full-service primary care centers with comprehensive primary and mental health services, and 7 of the 15 have dental now. But they were mapped based on population data, dropout data, et cetera. But I do see a concern, and I have a concern with the privatization of education. And so watching how parity and disparity rolls out as private schools start to pull kids out of the enrollment system and then are able on norm day to turn them back to public education systems. I'm worried about what that means for the systems, but I'm mostly worried about what that means for our children. And I wonder if you have any thoughts on that.
Well, like you, I'm a big supporter for public education. I am a person who went through the New York City public schools and went through the state university systems. So I share your concern. I know a lot of about a lot of interesting work going on in charter schools, in public charter schools, that can be really good laboratories for trying different ideas and seeing what works. But I too share your concern about the privatization of education, and I think it has potential to undermine the efforts, because of the students who they're choosing to enroll and not enroll in the schools, and undermine the public's infrastructure for this. So I think we need to strengthen that, not undermine it.
Batch these last 2 questions. So
Hi, Han Kao Yu, Chief Learning Officer with the California Endowments. I'm delighted that we're having conversations around this. In our Building Healthy Communities work, though, California, we've engaged with a lot of young people, and they talk a lot about the push-out effect of being denied education opportunities. So that's led us to do quite a bit of work around things like trauma-informed practices, restorative justice, culturally rooted healing practices, and interventions and implicit bias kinds of trainings, because we know a lot of what you listed up there around social determinant helps are deeply rooted in structural inequalities. So I'm just curious in terms of the evidence base around these kinds of approaches and its effectiveness around students' health and academic success.
Yeah, well, you know, I think one of the complications of looking at individual factors is when you think about academic achievement and educational attainment, it's something that has a multifactorial etiology. And if you just look at, so for example, if we're looking at, you know, these issues here, and you're looking at, it's great now we're getting kids eyeglasses. That's really meaningful. It's an important achievement. And now a much greater percentage of kids can see better. But, you know, if they're hungry, then, and if they have behavioral, mental and emotional health issues because of exposure to violence or sexual abuse or neglect or domestic violence, you know, you may not see the big effect on, you know, standardized test scores. So I think some of the times you have to do things because they're the right things to do, they're the fair things to do, and you have to set up other milestones for measuring success rather than necessarily, you know, norm-referenced metrics. That's how.
We're looking at things like expulsion, suspension
Yes.
rates that relate to absenteeism.
Yes,
So-
and I think that's exactly right. Thank you.
I'll be quick. James Allen with Chevron, and I thank you for this morning's presentation. It's really educational for me. I have a question, just a thought about, your slide about schools can't do it alone.
Yes.
I didn't see myself, because I didn't see the private sector, I didn't see employers. And I'm just wondering what your thoughts might be, if there might be something other than philanthropy, maybe that I heard an allusion earlier this morning about productive workforce in the future and investing for that. But I'm also I'm wondering about your thoughts on the private sector.
I appreciate your question, and I think it's totally my oversight. I think business and industry have a tremendous role to play and a tremendous vested interest. And I think there's lots of good examples where they've made great contributions. So that's my oversight by leaving that off. I kind of group them within community organizations, but I guess that should be a separate category. Yeah. Okay.
Thank you so much.
Yeah, of course.
Thanks, Chuck, for a great session. I asked to tell the group that we have a break until 10:35, but in these instructions, they asked me to include the word sharp. So 10:35 sharp.